So the Saline Sonogram, and that's a procedure where we're trying to evaluate the intrauterine cavity, and it's done by placing a speculum into the patient's vagina, cleansing the cervix with some betadine, and then we insert a small catheter through the cervix and into the cavity. We're doing one of two things. We're measuring the depth of the uterine cavity, and then that catheter is going to allow us to place sterile saline inside the uterus to distend the cavity to make sure that the patient doesn't have anything that would decrease the implantation of an embryo, such as a polyp or a fibroid or scar tissue. The procedure typically only takes about 30 to 60 seconds to perform. Most patients will feel the insertion of the catheter through the cervix and the touching of the tip of the catheter to the top of the uterus or the fundus of the uterus, but it's a very mild discomfort. And in our program, we allow the patients to watch the procedure, and so we have a screen up here where they can visualize what we're doing, and we describe what we're doing to them as we do the procedure. When we're done with the saline sonogram, then we also look at their ovaries with the transvaginal ultrasound probe. What we're outlining is the uterus, which is the darker shaded area on the screen, as well as the cervix. And then there's a very dark cylindrical area within the uterus, and that's the saline that's been placed inside the uterine cavity. And once the uterus is distended, you can evaluate whether there's a problem inside. The uterus is normally like a collapsed balloon on the inside, and until you fill it with saline or air, you can't really evaluate what's going on. And then the procedure is terminated. The only requirement for the patient is not to have intercourse for 48 hours after having the procedure performed.
When you come in to have the procedure done, it's really not that bad of a procedure. It went really smoothly, and I was given all the information beforehand, so I came in feeling very comfortable. So far, my experience with the Florida Fertility Institute has been very good. Everybody I've dealt with has been outstanding, above and beyond. I haven't quite finished everything that I've got to deal with here, so I'm sure I've met everybody I've got to meet, but so far everybody's been really kind.